The year has begun, and we're hearing a lot about a dry January when some people decide to stop drinking alcohol for the entire month.
Better health is one of the key reasons. But is the idea of dry January for you? Our Lisa Adams is joining us here in the studio tonight. Lisa, you talked to an expert from UPMC Hammett Western Behavioral Health at Safe Harbor. What do they think of dry January?
Well, good evening, Mike and Eva. I talked to the consortium director for Hammett Health Foundation and an addiction medicine specialist, too. Both like the idea of dry January. It brings concerns about excessive drinking out into the open, and it offers a support system of people doing it together. But if you have a more serious alcohol use disorder brewing, dry January may not be enough.
The 31-day challenge to curb drinking in January started 10 years ago in the UK to boost health and save money in the new year. Experts in alcohol use disorder like Dr. Amy Miles say it's a good idea that offers social support to rethink how much you drink.
Give people kind of a socially sanctioned opportunity to step back and simply reevaluate the amount of alcohol they're drinking and how often they're drinking. And so I think it's a good idea if people want to attempt it. But if they start seeing anything that is unstable medically with their situation, that's when we would encourage people to reach out to professionals.
Professional help, not just dry January, may be what you need if your alcohol use has become heavy.
When somebody has been drinking, for instance, large amounts daily, and they are dependent, then quitting can actually cause anything from seizures, cardiac issues. It can be really dangerous.
The CDC says for women, drinking becomes hazardous with more than 4 drinks per sitting. For men, more than 5. But you also have to consider just what is a drink.
In general, we're looking at about 12 ounces of beer, 5 ounces of wine, or 1.5 ounces, a small shot of a liquor would count as one standard drink.
With professional help, there are medications to diminish cravings, and it's a good idea to get the ongoing support of AA or other 12-step programs.
And maybe it becomes people do dry January and they feel healthier and they feel better and their relationships are improving and their energy and their health are improving, and they decide to maintain it.
So if you need counseling or medical help to maintain sobriety, the best place, they tell me, to turn for help is your county office of drug and alcohol abuse. They can refer you to a host of other organizations and services. In Erie County, the number to call is on your screen, 814-451-6877, or you can call the National Substance Abuse Health Line. That's 1-800-622-HELP. I understand tomorrow, coming up on First at 4, Joelle Matthews will be here to talk about dry January events around the region, including a mocktail pairing dinner at the Cork coming up later this month. Live in the studio, Lisa Adams, Erie News Now.